I want to get right into the material because there's a pretty good amount of material. And I want you to be able to understand the nervous system. And so what I've done, similarly, I did a training on disc structure. If you don't have the training on disc structure and you want that, comment disc structure, okay? And then I'll make sure and connect you with that training so you have that as well. What we're going to be doing today, again, is talking about nerve structure and how that lends to a full recovery, okay? So often we hear the word nerve and we think if it's injured, it's done. Or we think of permanent nerve damage, or we think kind of like these polar ends of the spectrum, and there is a whole lot of gray zone in between. And so hopefully as we go through this discussion of nerve structure, you start to see the opportunities for recovery that nerves actually have, and the principles. There's some principles around that recovery that we can take huge advantage of. So what I'm going to do, I'm going to start sharing images. Now you'll see these aren't my images, but I don't hide the website. So I'll tell you, I just grabbed these images because they speak to what I'm going to speak to today. I have not vetted these sources in terms of the material they're presenting, but if you want to go explore, the addresses are there. You can go check them out. I'm not trying to chop anybody's material. I'm just trying to give you guys the view that I'm trying to express in words. I'm trying to find the images that really fit. So I'm going to go ahead and share my screen, and we're going to get to work on this. As we're going, if you have questions, feel free to type those questions in. If you're confused about something, don't suffer in silence. If you're suffering in pain, don't suffer in silence. Comment support. If that feels like putting yourself out there too much, you guys can message me directly. If you have trouble with that, go ahead and make sure we're friends. So go ahead and send me a friend request, and we'll connect as friends, and we'll make messaging a lot easier. And that'll also help you to see future trainings. So if we're friends, Facebook will let you know when we're doing future trainings. So it will give you an advantage in terms of being able to see those things. Okay, so here we go, cutting to the chase. All right, so I wanted to start and just share. So this image right here, this one on the left, is meant to be a representation of your spinal column. Okay, so these are the vertebral bodies. If you checked out the disc structure, a lot of this will look familiar to you. So we have the vertebral bodies, those are the bones. And then on the back here, we have these spinous processes. These are helpful for muscle attachment, and it also helps to protect the cord. And so what we're looking at, so this little nubby up the top is meant to be the brain stem. I'm not sure why we didn't include the brain on top of that in this image, but that's not what we're covering. We're not covering the brain. We're talking about nerves. And so we have to start. So we have the brain, and the brain branches off into the spinal cord, and the cord travels through the spinal column here and kind of terminates down at the bottom. Now, along the way, there's nerve roots. And so we're going to jump right on over here to these images on the side. And so again, this top image, the white part, the structure here is a vertebral body. And then here we go. If you caught the training on disc structure, here's a representation of a disc. You can, if you've watched that, you know this is a very simplistic version of it, and the complexity of it is actually what helps lend to the recovery of the disc. So again, if you're needing that information on disc structure to help you understand how discs do so often recover on their own, but how you can also do things to help to support that recovery, comment disc structure, and I'll get that to you. Okay, so now what we can see is kind of here in the back is, this is the spinal cord, and they're showing sort of it lopped off. So they're giving you a top-down view of the spinal cord, and then you can see these little things on the side, okay? So these are the spinal nerve roots. And then when we jump down to this image here in the middle at the bottom, okay, so this is the spinal cord. It's like just a tiny segment chopped out of the spinal cord. And you can see that the spinal cord inside of it has its own structure, okay? And this structure is functional. There is a function to how this is structured. And so you can see how that how the structure lends to these branching off into these spinal nerve roots. Okay, and I'll show you how these are arranged according to the spine. You can see it up here, right? So here's these spinal nerve roots, and you can see them starting to exit the spine. Okay, so we have an anterior and a posterior. So we call it like dorsal nerve root, and one of them is dedicated to sensory pathways, and one of them is dedicated to motor pathways. So sensory is like sensing our world, and we have a lot of senses, a lot of sensory receptors. Okay, 5 senses, but we have so many sensory receptors, and those are important. Not only in helping us to kind of read our world, but they're really important in recovery too. Okay, and so we can get into that in a later program, but I just want you to see how, so these 2 branches actually come together and they form what's called a spinal nerve. Okay, and so at this point, you may be kind of wondering, like, spinal nerve versus spinal cord, versus neuron. If you know much about structure already, you may be wondering, like, what's the connection between spinal nerve and neuron. And so I'm going to try and walk us through that. So let's go ahead and venture forward. But first, okay, I wanted you guys to see like sort of a more lifelike version of what's going on here. So here we have the vertebra, okay, and this is like a sort of a top down at an angle version of looking at the spinal column. Oops, let me click off that. And then here we have the spinal cord, and you can see there's like this covering of the spinal cord, and then there's an inner material of the spinal cord. And then here's these nerve branches, the motor and sensory branches, and they come together for these nerve roots. And you can see how thick these things actually are. They're not tiny, neurons. These are big nerves, okay? And so nerves, basically, it's a bunch of neurons, which is a nerve cell, packaged together in a nice package, and we'll talk about the value of being packaged together that way in a little bit. But I just want you to see how these start to exit the vertebra. And so this little area here, they exit through a little tube here called the foramen. And this is a point of contention for a number of people. If you have foraminal stenosis, or if you suffered that, you can just type relate. I'm not going to ask you to spell foramen. If you want to spell foramen, feel free. But these things exit through the foramen, and so this is important because this is a spot where a lot of people will have problems. Okay, and it also is a spot where we can gain a foothold on helping these nerves to recover. So the way that the structure is, it can set us up for problems, but it also gives us lots of advantage for taking care of any sort of nerve issue or nerve pain you may be suffering. Okay, so again, if you know, like, so some people, they've had imaging done, and this disc here is bulging and it's pushing up against the spinal nerve, and it's creating an impingement, and they're like, what do I do? Well, there's a couple of directions that people will typically follow. The most common one is using some type of a McKinsey approach, or something to help unload the pressure in this, in a sense, to directionally unload the pressure in this disc and get the disc to pull away from the nerve. But sometimes actually doing those techniques irritates the spinal nerve. And so most typically my direction is, let's unload the spinal nerve first, because as we do that, we actually do unload the disc somewhat as well. So it's kind of a 2-for-1 special. So if you are suffering at that foramen, you can just comment support, and I'll reach out and see what I can do to help out. Okay, so I wanted you to see how these nerves, so these are spinal nerves, and basically what that means is it's the spinal cord, and it branches into these nerves, and then these nerves exit the spinal column. That's basically why it's called a spinal nerve. But let's look at this and relate it to you guys, right? So a lot of you folks suffer what's called a cervical radiculopathy. And so you can see how there's branches of nerves, and these branches of nerves come back together, okay, to form a bigger nerve. And then if you've ever suffered cervical radiculopathy, sometimes you may suffer an issue at the brachial plexus, and that's just a bunch of nerves that kind of bundle together, and they venture away from the neck down into the shoulder, and kind of they go over the first rib here and under the clavicle. And so this can be a point of contention here, the thoracic outlet, we call it. And then they branch down, and then they go down into your arm, and then they start to branch apart as they get down into the arm. So they exit the spinal column at these spinal nerves, but then these spinal nerves rejoin, and then they separate again and form these different branches. Okay, and so if you're wondering like what goes on in your neck, look at all this. There's a whole lot going on. And so same thing at this nerve root, we have some opportunity to help with recovery. And along this thoracic outlet, through this brachial plexus, there's all along this are places where we can get irritation to the nerve. But because of the structures that surround the nerve and support the nerve, we can actually position the body to reduce the irritation on the nerve. And so hopefully as you get a view of the structure, you start to understand that there's some opportunities here, because we can open the thoracic outlet, we can unload the tension on the brachial plexus, we can open some of these other channels as the nerve branches down through the arm. Let me see if I can, does it go down? No, it doesn't. I think that's on this one. Let me go over here. Okay, so we'll look at this in a little different light. So this is more of like an anatomical, like if somebody's studying an anatomy class, this is kind of what they're going to end up seeing. So these yellow ones are the nerves. We do have an artery coming down here. The yellow ones are the nerves. And so you can see how they kind of like branch away and branch together. And then they start to branch, they start to separate as they go down into the arm. So I wanted you to see these branches as they start to separate and go down into the arm. And so sometimes you'll have sensations in different parts of your hand, and that can actually be indicative of which nerve may be suffering. So you may have symptoms in your hand, but where the problem is may actually be in this tunnel, right? So if we're talking about like the ulnar nerve, right? So there's a tunnel that this nerve goes through, and that tunnel sometimes can get compressed. And so there's ways to unload that. Okay. Likewise, we have the radial nerve as it comes down. And so you may have symptoms in your hand, and they can be indicative of something going on with the radial nerve. And so there's actually a little tunnel that this travels through, and there's a way to unload that. Now, sometimes you're feeling stuff down here, you're feeling stuff in your forearm, or you may not be feeling stuff in your forearm, but you're suffering because there's some sort of irritation, damage, or compression, something going on further up the chain. Okay, and so that's the thing about nerves, is that they're going to communicate up and down the chain. I'm going to go ahead and stop share for a second, because I want to make sure that I check in on what's being communicated, if you guys are having any questions or anything. So I want to just pop in there. And so yeah, okay, so we see Elaine on here, Amy. Okay, so seeing some folks make some comments. I'm not seeing any questions, so I'm going to go ahead and go back to get back to the images. I will reach out. So if you've made a comment, don't worry. I'm gonna reach out. I just can't do it right now. So okay, so we're going to go back to the screen share, and we're going to continue on this trail of looking at these nerves and how they are arranged in the body, and then how that can affect your ability to recover. So I wanted to show you sort of like, at the neck. So things can happen through the thoracic spine as well. Okay. And I don't want to dismiss that, because we do have people in the community that suffer thoracic spine stuff. But hey, sorry, for the sake of time, I'm going to jump down. I'm going to go with the stuff that's most common. Vastly most common, we have cervical radiculopathies, and then we also have sciatic nerve stuff. Okay, so if you've suffered a cervical radiculopathy, you can comment CR. Okay, CR for cervical radiculopathy. That lets me know where you're at. Now, if you've suffered from something with your sciatic nerve or something into your, buttock, hip, leg, low back area, just comment sciatic. If you know it's not sciatic, but it's lumbar that you suffer, you can comment lumbar. If that feels better to comment that. Either way, I'm going to try and connect you with material that's specific for you. So right now, we want to continue with understanding the structure. So I think this is really important. Folks, look at this. See all these little branches? So what we're looking at is kind of like we're seeing the tail end of the spinal cord here. It actually terminates a little higher. And then we have all these nerves descend. But then you can see how these nerves are branching off. So these are the spinal nerves that are branching off. See how they're branching off and then reconnecting, and then they're all coming together down here. Now, some of them branch off into other areas up here, but they're coming together in this sciatic nerve. Look at that honker of a nerve. That's a big sucker right there. Okay, they're already actually pretty big as they exit these branches as they exit, but as they come together in the sciatic nerve, it's a big nerve. You can feel it. Okay, so working in person, sometimes I'll go in and I'll look for it on people's hip and down into their leg. I'm looking for the sciatic nerve to see if it's irritated, see if it's suffering, and there's things that we can do there. But from home, there's so much we can do, and I always want to help my people understand what you can do for yourself, because there's only so much impact a therapist can make in a session. The biggest impact you can make are the things you do at home. I hate to tell you that. It would be great if you could just walk in and fix me. And sometimes people feel like that happens because they feel better when they leave. But the reality is you're not fixed until you handle, and it's just the reality, right? It's about lifestyle. It's about habits. It's about the things that you're doing for yourself. They can either be nurturing and building and setting you up for a lot of high level function for the rest of your life, or they can be slowly eroding you and tearing you down. And we don't want to do that. We want to learn the skills, and they're simple, folks, very simple skills that you need to learn to take care of these nerves. Now, if you're suffering at a particular spot, it makes it even more simple because you only have to really focus on that spot. You can just do, basic exercise to support your body otherwise. Okay, so I want to just see how this all branches and comes together again. And then let's move on down. So the sciatic nerve, okay, here it comes out. And so right here, hey, if you suffered this, I'm sure you know how to spell it. The piriformis syndrome, right? The evil piriformis syndrome. So right here, the piriformis muscle crosses over, and it can actually compress the sciatic nerve. And so it feels like a true sciatica. You're having all these nerve symptoms, but there's nothing going on up here in the lumbar spine. And what can actually be going on is for some reason that piriformis is in a protective spasm. And so you can stretch it, you can foam roll it, you can do all these things to relieve it. But until you understand why that nerve is being protective in the first place, you're probably going to be playing the push me pull you game with this piriformis syndrome. So if you suffer from piriformis syndrome and you know it, or you really, really think it, go ahead and comment piriformis. If you don't know how to spell it, or you don't want to spell it, I'm going to tell you, I'm going to make it really easy. P-I-R-I. That's it. Piri. Just comment P-I-R-I, and I'll reach out. If you don't want to spell that, just comment support. Okay, and I'll get you some resources for that. Okay, so and as I'm saying this, I want to be transparent. Okay, yes, I want to connect everybody in this community with some type of resource that's going to be supportive for you. And no, I can't completely solve your problems with just dropping a resource, a tip, or a clue, or something like that. Okay, so that's why I do offer coaching. I do offer the process of working all the way through front to back. Are the resources I offer valuable? Oh yes, oh yes. And sometimes they're a one-hit wonder for people. But the reality is, unless we're following the chain, so the chain has to do with function. And if you've gotten to the point where you're having pain, a whole lot has already gone wrong with function. And so taking care of the pain is really only one step in the process of preventing you from having problems in the future. And so there are other steps. I do make them super simple for you, step by step, little by little. My clients know. Okay, so as this sciatic nerve comes down, it branches out. Okay, and so it branches out, tibial nerve, peroneal nerve. Okay, so it branches out and it goes all the way down into your foot. Okay, so if you're having symptoms in one part of your foot, it kind of tells us that one branch. If you're having symptoms in your whole foot, it kind of tells us maybe these branches are suffering. There's little tunnels, little tracks that these follow, and we can have problems there. And there's a way to kind of figure out where that may be coming from and then unload it so you get relief. Or it may be that it's the sciatic nerve is suffering and you're feeling things down lower in your leg. Okay, so we're getting there. We're gonna get there quick now. Okay, so here we go. Okay, so what's a nerve? Remember, I said that these nerves are actually a bundle of the actual functional unit of the nervous system. It's called the neuron. That's actually what people will refer to as a nerve cell, is the neuron. But in this top image, you can see, hey, it's called a nerve. Okay, and so a nerve is actually a big bundle. Okay, this is kind of like what they do with fiber optic now. They put all these little fibers and they put them in a big bundle. Okay, but your body figured it out first. And so this bundle, it's really cool. Let me see if I'm gonna make sure I'm kind of forgetting no, I didn't do it. Okay, so I'm going to talk you through it here. So you can see how there's sort of this, here's the big bundle, and then there's like a smaller package. And then from the smaller package, we have even smaller packages. And from the smaller packages, we have the single nerve fiber. Okay, so I want to talk about this bundle first, because that's mostly what you guys are suffering. It's the bundle that causes the biggest problems. The most simple way that nerves start to suffer is because of this bundle. And let me show you the most common thing here. Okay, so it's not this nerve cell. Okay, you end up feeling the nerve cell. It's not even one of these nerve bundles. Look at this over here. Okay, these are blood vessels. Okay, and there's veins and arteries. And the veins and arteries service these nerves. So they go through these nerves and they actually kind of surround the nerve as well. And what the nerve is basically a big old package of connective tissue that houses these neurons. So I'll repeat that. It's a big old package of connective tissue that houses these neurons. And so the outer layer we call the epineurium, it surrounds the whole bundle, okay? And then we have a perineurium that surrounds these smaller bundles. And as we get in, we have an endoneurium, and the endoneurium can actually surround the fibers. And so that stuff is super cool, because that stuff helps to lend to your recovery. Okay, so that stuff, when we get, like when there's outside damage, that stuff can get damaged. But a lot of times it's the stuff inside that gets damaged. But let's back up. Sorry, I'm jumping ahead. I was talking to you about these the circulatory system. Okay, veins. Veins are very easily compressible. Okay, this nerve is compressible, but remember, it's all this fibrous structure. This fibrous structure is pretty tough stuff. Okay, this connective tissue stuff is pretty tough stuff. And so the nerve is meant to be kind of pressed and moved and twisted, and it actually stretches. Okay, so it's actually kind of stretchy stuff. Okay, and that allows us to do like big movements and take these nerves to greater lengths. But the nerves also slide. So this nerve will slide through other tissues. Okay, and it'll twist. All right, and that's all fine and dandy until, and so again, the most common thing to happen is that we get enough compression that one of these veins becomes occluded. This vein gets closed, and veins are very easy to close, unfortunately. And so a vein can then, when it's closed, it starts to back up. And if it starts to back up, there's a buildup of waste, because a vein is carrying waste product away from your body back to your heart, where it can get cleansed again, so to speak, and then returns through the artery to deliver all the nutrients and all the stuff you need. Okay, so when this vein gets compressed, that's when we start to have problems, and these nerves, these neurons will start to suffer. Okay, and I'm going to talk a little bit more about the structure of the neuron, because again, it lends to recovery. But let's keep this in mind, all right, that if this vein gets closed, then we really start to suffer. So guess what is super cool about this is that all we have to do is take that pressure off that vein. All we have to do is give this nerve a little bit more room at the right spot, and all of a sudden, everybody starts feeling better. Not like an immediate turnaround, but you notice almost immediate results. And so if you guys have hit me up for resources, some of you have already done this and noticed a little bit of result, and you may have thought, oh, I got a little bit of result, but it didn't take care of my whole problem. Well, maybe we didn't dose it enough, okay? Because I try to give you instructions on how often, how much, how often. But again, it may not be at one spot. There may be other spots. So we want to continue on our search to make sure that we're dealing with all the issues that are affecting a nerve, because they're long, right? They go all the way from my spinal cord down to the tip of my finger, or from my spinal cord down to the tip of my toes. And so there's a number of spots where things can go wrong. And again, hopefully this is helpful. If this is helpful, comment helpful. If it's not, then send me a private message. Now, if we're missing something, if there's something you feel like you need that is not showing up here, type it in. Let me know what we're looking for, and I'll see if I can find it for you. I may already have a resource for you. Okay, so let's go ahead and continue forward. And so I like this version. This is really cool because this helps you understand the complexity of a cell. This is one nerve cell. This is the cell body. This is the axon. So this is the little branch that goes down through the nerve. And then this is the terminal end. This is the end that may connect to other neurons. One other neuron may connect to a muscle, may connect to some other effector site, but this sends the message. So this nerve is sending the message, and a nerve sends the message in the one direction and lets everybody know what's going on. But look at this cell, okay? Super complex, and it's even more complex than this picture lends to, because there's a whole structure inside of this called the cytoskeleton. It's all this connective tissue, and it's crazy, folks. This stuff can like move around and reposition itself based on what's going on. So when there's damage to this thing, damage to this thing can happen in a number of ways. It can happen to this blue stuff. So this blue stuff is called myelin. And myelin is like a fatty substance that grows around the axon. And what it does is it helps the axon work better. So if the myelin gets damaged, the axon doesn't work as good. We can actually have damage to the axon itself. If there's damage to the axon itself, then now there's sort of like an intrusion into this cell. And so the cell is going to respond by getting rid of some of the damaged stuff and then trying to rebuild newer, healthier stuff. And remember, this is encased in a connective tissue, and that connective tissue is like a package that helps tend to this stuff on the inside. So if that connective tissue is intact, this thing tends to heal faster. If that connective tissue gets damaged or completely severed, we can have other problems. And sometimes those problems get so big that we can't recover this nerve. But guess what? We got a whole lot of these nerves. Okay, or sorry, neurons. We got a whole lot of these neurons. And so sometimes this thing gets damaged. Other neurons will grow connections to this neuron so that we get a higher level signal going to the body or going back to the brain. There's just some crazy, interesting things that happen. These dendrites, these little branches, these things will prune and grow throughout the life of the cell. These things will prune and grow. What I mean is they'll pull back and they'll reach out, and they'll pull back and reach out. And the life of these things is uncanny. All right. And yes, they can get damaged, and yes, they can get damaged permanently. But I wanted you to see, like, this little thing, look how complex the one cell. So we backed it up and we saw all those nerves. And in those nerves, you can have hundreds and hundreds of these little things going through. And one cell, the complexity of it, and the energy and the effort for life. Okay, this is something that we can't quantify exactly, is this effort for life. And this cell, it responds to the outside world, in a sense, on its own. It will do all these things to protect itself and to regenerate itself. And so you are a thriving metropolis of these cells. And so don't get confused and think that just because you're suffering a little bit, that you can't be repaired, because there's so much repair that can happen. Okay, so I wanted to break out, and so this one was just a little simpler version of the cell, and I wanted to do this because it shows how it connects to a muscle fiber. Okay, so basically this neuron is telling this muscle fiber to turn on, or allows it to turn off. Okay, and so that's the message that is being sent to this muscle fiber. And so for muscles, they have a whole lot of these axons connecting to a muscle. And so even if you have one that's completely damaged, that muscle can still be functioning as long as we have enough connection left. But that needs to be stimulated, that needs to be supported. Okay, so hopefully this has been helpful to you all. If it's helpful, comment helpful. If it's confusing, yeah, comment support. I want to make sure and have you guys feel like this has been something to help you start to understand some of the opportunity. Again, one of the big opportunities that people miss is that connective tissue. That connective tissue is some really incredible stuff. I didn't go into the structure of it, but it actually helps all these cells to stay healthy and helps these cells to become healthy again. So I went a little long on this one. I apologize, but we tracked a lot of pathways. If you still have questions, you can comment with the questions. If there's something you want me to cover, you can comment with that, but you can also reach out to me directly. It works better for friends. So if we're not friends, go ahead and friend request me and we'll connect. Hey, thank you all so much. And I'm looking forward to connecting you with more resources.